There is now strong evidence that mental health has a direct impact on the physical health of patients and vice versa. It impacts not only their day-to-day quality of life, but life expectancy itself.
Within a couple of years of Mary first becoming ill, it became quite clear that there was considerable physical health issues that Mary could expect later in life. You know, people like my daughter can expect something like 10, 15, 20 years shorter life than other members of her family.
Programs are now underway which seek to address this issue.
If we address physical health, what we've seen is benefits for general well-being and confidence and mood, and we've actually found SHAPE as being a platform to people doing other things as a result, as an outcome of becoming physically fitter and feeling better about themselves.
What we do tend to see in mental health is especially medication that can tend to cause weight gain and, you know, comfort eating. If someone's feeling quite down, people have coping strategies of wanting to eat that bit more or go into the comfort foods.
This tendency to put on weight by people with mental health conditions presents many challenges for carers and health professionals, which are now being widely recognised. It is cementing the idea that mental health and physical health are closely linked and must be treated as a whole. Mary was diagnosed with schizophrenia when she was 16. Her father, a GP at the time, became very involved in her care and in the treatment of severe mental health generally. He noticed the direct relationship between his daughter's illness and weight gain.
She was taking a large amount of drugs to sedate her. She was terrified. I mean, the paranoia was serious. She was bewildered. We were all bewildered. She isolated from school, so she lost contact with all her normal friends, and you know, the normal things in her life just ceased, just stopped. So in that setting, the staff actually felt quite sorry for her in the institution, so they offered her extra helpings of puddings because Mary liked eating. And part of the reason that she liked eating was that she was taking medicines that made her eat a lot. But also there was nothing to do. But she gained 4 stone in weight, so she went from 9 stone to 13.5 stone in the space of, I suppose it would be 18 months. And she didn't like gaining weight because it's part of what stigmatises you and makes you different from your friends. So not only did she have a serious mental illness that excluded her, but she was also then beginning to change her shape.
Most evenings when Mary's at home, we have a little walk, don't we, Mary?
Modern drug treatments and care methods have made it possible for many patients to be less stigmatised and cared for in their own homes. However, many challenges remain. It became clear to Dr. Shires that the way general practice responds to these risks was out of step amongst younger people with mental health conditions like Mary.
General practice is geared to dealing with vascular risk in people of the age of 40 upwards. And that's how vascular risk is, the NHS encourages that approach. But for this population, developing a condition which puts them at vascular risk 10 to 20 years earlier, they're not getting access to the sort of approaches that they need because they're they're young, and most of the approaches in the NHS are geared to people 20 years older.
Research shows that people with mental health conditions are likely to die 10 to 20 years before those in the general population.
We shouldn't accept the inevitability, in this case, the inevitability of weight gain, reduced life expectancy. That is a pessimistic outlook, and it doesn't need to be. We really need to change our game, and we need to change it very early on.
3, 2, 1, go!
In Worcester, the SHAPE programme began in 2014 in partnership with the University of Worcester, specifically to improve the physical health of people with mental health conditions at an early stage.
3, 2, 1, go!
The aim behind SHAPE is that, particularly with young people, we felt that the peer group was important. And lots of people, any member of the general public, can go to a gym, but you can't do sports on your own. You can't do badminton or basketball or social things.
In addition to exercises, the programme includes a range of social activities including badminton, basketball, Pilates, yoga and a walking club.
It's always difficult to motivate young people to come to groups anyway, obviously, because it's quite anxiety-provoking to attend a group. So it's obviously depends on individual needs, and some of them maybe will come and take part in some of our walking group first, or they might come and do some circuit training, and it might be that the first time round within the 12 weeks they don't attend, but then they will often think about it, reflect on it, and then come back.
Kevin was diagnosed with psychosis 10 years ago, which progressed to paranoid schizophrenia. He first joined SHAPE 2 years ago. Now he's back for another 12 weeks to monitor his progress.
To start off with, I was very hesitant to come. I was nervous, I didn't know what was going to happen, I didn't know what they expected of me. There are many things going through my head, but I'm glad, I'm very glad I came.
The way the program is designed, particularly on the exercise pathway, is to actually get individuals to improve their decision-making capabilities when it comes to physical health. So how do I know what I need to do? How do I make the right choices? With that comes self-esteem, and your ability to make decisions. And as they go through the 12 weeks, what we aim to do is to start building that self-esteem and then allowing them to give them kind of that control and independence to say, this is my health, and understand what that information means. So when they do calculate their heart rate, what does that actually mean? How do I need to change my behavior? Do I need to walk faster, walk slower?
In Chesterfield, home to Chesterfield Football Club, the Spirates Active for Life programme is named after the club's football team.
So Spirates Active for Life is mainly a group that's to adopt a healthier lifestyle and to help people participate in meaningful occupations again. So it looks at people's behaviours and lifestyle changes in which they can make to their lives for the future.
Scott, a regular participant, was diagnosed 12 years ago with bipolar disorder.
It kind of turned my life upside down, and for a long period of time I was able to manage it effectively, and then when I had my most recent episode, it did become quite out of hand, and I suffered a period of prolonged depression.
Scott was treated with standard medication and was given a rescue action plan which included physical exercise.
It's one of those things where there are a lot of barriers to taking part in physical exercise when you're suffering from a mental health problem. Confidence is a big issue, motivation is an issue. There's a real feeling of isolation, so actually making that first step to get out the door on your own can be really, 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 really tough.
If people like Scott are to be helped, then they need extra support. Working with Spirates Active for Life is Dr. Paul Rowlands, who, alongside others, helped develop the programme.
Because if you're troubled with terrible mental health problems, maybe your physical health isn't the number one priority for you. Now, what I would say is that we know that this creates what we see as a mortality gap between people with mental health problems and the general population. So, in terms of addressing that mortality gap, we have to do something about the physical health for our patients. How do we make this into a better system that can narrow that mortality gap between people with serious mental health problems and the general population?
It's easy to say, well, I think you should walk 3 times a day or, 5 times a week and, do this much exercise. But you need a network of support around you to really get you started sometimes. Otherwise, it's too easy to start with good intentions and then to fall away while you're dealing with your everyday problems.
One of the things that's really important from my mind is making this part of the conversation. So when you're with your doctor about your physical health, then there should be some discussion about how you're feeling and what your mental health's like. And when you're with your nurse, occupational therapist, your psychiatrist, your support worker, people should be comfortable conversing about physical health as well. And we should be getting it as part of the conversation.
I worked with Professor Lester, the late Helen Lester, and one of the things that we did in the last 5 or 6 years was to develop what became known as the Lester resource, a very simple framework for monitoring people's cardiovascular risk and metabolic risk. And the slogan of that resource it has been, don't just screen, intervene. And that's the thing, I can screen people till they die. If I'm not taking any action about the things that I see are going wrong. And it isn't just sufficient to tell people you should be more active or eat less. You've really got to equip people with the necessary skills to do this.
So, welcome everyone. This is a snack tasting session. The focus of today is on
Part of the SHAPE programme includes a session on nutrition and how to balance one's diet.
Obviously, when you have a mental health condition, we know that it can impact on eating.
Today's session is about managing the intake of calories while snacking, and also about where to buy such snacks at a good price.
Everything I've bought is a reasonable kind of budget option, but it's all sort of quite healthy or healthier than many other snack options. So, well, we know from some of the evaluation work that we've done that people do change some of their behaviours. So people at the end of the 12 weeks are eating more fruits and veg, and we know that some of them are buying some of the snack foods that we've tried, especially when I tell them where to buy it from.
Cheese. What I do when I'm looking, if I was going to buy it at the shop, I'll turn around and I'll say, I'm normally looking at bats these days.
Yeah, but I think that's the wrong way for you to look at it, because so I know that you're trying to lose weight. The thing that you should focus on is the sugars. The more you put sugar into your body, probably the hungrier you're going to get.
Well, I'm a lot more confident now. I needed the boost to get my confidence back. That was probably the main thing that stopped me going out of the house. So a big confidence. Also, I understand my illness better. I can understand what my mind's doing, why it goes on, why it does what it does, so I can kind of not believe in it so much. Yeah.
Knowing what he knows now about mental health versus physical health, early intervention remains the most important factor for Dr. Shires.
Looking back on the 20 years, I still, I was convinced at the time that we should take things seriously very much earlier on. So I'm still convinced that, the key is really early on. I've just been part of a small group in Manchester looking at developing a service user resource. And we've called it Right from the Start. And this is not rocket science. These are very simple things. But this is a resource to try and raise the expectations of people using services and their families to expect more from us as clinicians.
Whilst clinicians can and should be challenged, patients with support from carers can help themselves by giving up smoking, eating more healthily, and exercising regularly. They should ensure that they have their annual health checks done, as well as negotiate the right treatment that addresses their health concerns.
I think change has got to come from within us to develop the opportunities that can promote better physical health for people. The patient is at the centre of it, and it's their care that needs to be delivered in as effective a way as possible by harnessing all the parts of the different parts of the system that might be involved in delivering that care. There may be many other ideas that people might have that can just put the idea of physical health, keeping the body in mind, so that people are thinking about it.
We've seen huge benefits. In the first 8 participants we followed up at 12 months, 3 had given up smoking as a consequence of the programme. We've seen people who've lost quite dramatic amounts of weight, but a lot of people are reporting psychological impact in terms of their emotional well-being, their confidence.
Taking part in social activities alongside other people with similar conditions has had a life-changing effect on Scott.
It's made a huge difference to me. Before I started doing this course, I couldn't be here talking to you now with this level of confidence. It's enabled me to go out and try other things. So as a direct result of doing this, I've been able to add things to my routine to do with physical exercise, to do with regularly playing football, to starting playing basketball on a regular basis. And it's just, part of it is enjoyment you get from it and lifting your mood. Part of it is the confidence that it instills in you to say, right, I can do this.